Development and Delivery, and Lucy McMichael, Senior Lawyer, Scottish Government. I'd like to invite the Minister to make a short opening statement.
Good morning. I'd like to thank the committee for its consideration of the NCS bill. It remains critical that we get this right. Strong social care and community health support are the bedrock of a thriving, compassionate civil society. Given the many areas we agree on, I appeal to members across the political spectrum to engage collaboratively on this endeavour. I'd also like to thank the many organisations and individuals who responded to the committee's call for evidence. The overwhelming majority of respondents recognise the status quo cannot continue and fundamental change is required. This echoes the thousands of conversations my officials and I have had with people across Scotland who use social care and community health services and people with caring responsibilities. In these discussions, people have told us three key issues required urgent action: shifting society's attitude to ensure social care is properly valued, access to consistent, high-quality support and services targeted where and when they are most needed, with clear information about availability. There is an unacceptable variation across local authorities, and oversight of planning and delivery. This committee's post-legislative scrutiny of the Self-Directed Support Act has itself highlighted the importance of this. Here we have the furthest to go to reassure people with lived experience they've been heard and we're taking action. The bill is intended to address all three issues with structural reform that further empowers the role of people with lived experience. The bill and draft amendments that I sent in June represents how best to achieve this reform. As you're aware, while some draft amendments have garnered broad support, we have encountered opposition to other proposals. I can answer questions about the government's policy intention behind those proposed amendments if helpful, as they're part of the consensus we're working on. I need to consider what approach will secure sufficient support to progress. For these reasons, on the 13th of November, I wrote to the committee and I said I wanted to take time to fully reflect the views expressed in our approach, that I was not seeking to start stage 2 today. This was a necessary step to ensure that we get this right. We need to come together, agree the way forward and deliver for people who need it most, those who use or work in social care and community health services and those with caring responsibilities. It's vital the needs and voices of people with lived experience are put first. We must together work together to develop a social care system that we can be proud of.
Thank you very much, Minister, and we'll move straight to questions. And Sandesh, Gulhane.
Thank you. A declaration of interest as a practicing NHS GP. Good morning, Minister. Minister, are you responsible for and in charge of the NCS, or is there somebody else in government we should be speaking to?
So, as you're aware, I am a junior minister with responsibility for those things in my portfolio, and I work as part of a team of health ministers, and we work as part of a cabinet structure within government.
So are you in charge of the NCS, Minister?
Yes.
Okay. And Minister, in your statement to Parliament and on BBC Drive Time comments on the 14th of November, given that statement and the things that you've said, have you been entirely and wholly truthful on what occurred between the Scottish Government and COSLA?
Yes.
Okay. Minister, the forecast cost from Scottish Government is up to £1.3 billion over 5 years. How much of this will be an increase for frontline services?
So that statement's incorrect. The forecast cost of the National Care Service as refined is £345 million over 10 years.
And how much of that would be an increase in frontline servicing?
So there has been significant increase in frontline investment over this term of Parliament. We had an ambition to increase investment by a quarter, and we have achieved that earlier than expected. I would expect, with the rising ageing demographic, that our frontline costs will increase over the next 5 years.
Okay.
I guess in actual fact, the financial memorandum is about the cost of the bill, not about the cost of social care. At the moment, we spend £5.75 billion per year on social care.
Absolutely, Minister. So that money is for the cost of the bill, not going directly into frontline services.
345 million, but that does cover some frontline services.
Okay. And here in Parliament, 4 different committees have criticised and, in some cases, rejected the National Care Service Plan, and yet you continue to push it forward, putting taxpayer £30 million in the cost, and the social care workforce who rely on the care at risk. Why did you continue to push it when all these committees were telling you there were real issues going on?
So what we did when the bill was introduced, there was a number of committees and stakeholders, committees in this Parliament, opposition parties and stakeholders who raised concerns about the bill. That's why we paused and refined. We worked very hard to strike an agreement with COSLA and the National Care Service, which we did last June, on the tripartite shared accountability arrangements. And from last June, we've worked together on that point. The amendments that I sent to this committee this June were draft amendments that were intended to bring that to life in legislation.
Okay. And so you touched upon the amendments that were sent across. So about 46 amendments, I think it was. And that really did completely change the bill as was originally drafted. Yet we went through stage 1 and then retook evidence. Now, what you have said to us is you don't want to continue with stage 2 just yet. You're going to take time to listen. But the letter seemed to indicate that you are removing part 1 of the bill. Does that mean that we need to start again for consideration of whatever proposal the government put forward again for the NCS?
So I don't think so, no. I think that it's very well established that there's a great deal that we agree on within the bill. What I need to do is hear from opposition parties, stakeholders, which parts of the bill they are in agreement with and which parts need refinement. And I am in that process at the moment of listening and reflecting on what I'm hearing and making decisions on how to move forward. What is clear, and you know, you'll have heard this in the evidence within this committee, what is very clear from people who access social care, from people whose loved ones depend on social care, is that the status quo is not acceptable. That currently, many people are telling us the social care system in Scotland is broken and there needs to be fundamental systemic change in order to deliver better social care. So I'll be keen to hear from all political parties in this Parliament how we proceed.
Thank you.
Emma Harper.
Thanks, Convener. Good morning to you, Minister and officials. It was just to pick up on what you said about the variation in care across Scotland. And I know that we've got certain local authorities that are one local authority, one health board, and then there's others that are the health board will have then up 3 local authorities working with them. So in terms of health and social care integration and the variation that you're describing, for instance, delayed discharge, isn't that part of why the service needs reform, why we need our people who provide care, but people who also access care? They're asking for change, and the variation is one aspect of it.
Absolutely. So that's one of the most crucial things that people are asking us for. They are unhappy with the postcode lottery that they face at the moment, so that people in one part of the country have one type of social care system and access to certain services in another part of the country completely different. The delayed discharges, the focus on delayed discharges, it's not because it's the most important thing about social care, but to me it is indicative. So it's like a tip of an iceberg showing a dysfunctional system. And the social care, the delayed discharge numbers vary by a factor of 10 across the country. So the worst area in Scotland is 10 times as high in terms of level of delayed discharges as the best area in Scotland. I think that's an unacceptable level of variation for our citizens to have to tolerate. I agree with them that needs to change.
Okay, thanks. And I know we're going to come on to integration later, so I'll pause there. Thank you.
Thank you. Paul Sweeney.
Thank you, Convener. Thank you, Minister. During our stage 2 scrutiny of the bill, it was clear from numerous stakeholders that there was an immediate need to pursue concurrent reforms, even notwithstanding the passage of the bill. So to that extent, what scope of measures are you considering to address immediate concerns in relation to a number of factors that were brought up by stakeholders? These include the recruitment and retention of staff, ensuring consistency and equity in how social care is delivered, the complex governance landscape of integration, unmet needs and weights for assessments, and the right to break for carers.
So you're absolutely correct. I've personally spoken to hundreds of people during this bill process who are accessing social care. The team have heard from thousands of people, and people are telling us loudly and clearly that the system is not working at present. We have increased investment. So as I said, we set ourselves a target of increasing investment. So many would say that the fundamental challenge is a lack of investment. I wouldn't disagree that social care needs more money. However, we have put in $1 billion extra in the last few years, and we haven't seen the systemic improvement that we would expect from that investment. That indicates, and Feely looked very closely at the system. What he said was the system very clearly needs reform. It is not simply a case of investing, pumping additional money into a system that needs reform. We've got a whole suite of work going on, so we have a lot of work going on to try and improve the conditions for social care workers. We've worked very closely and are close to delivering a system of collective bargaining. We have a lot of work going on to attract people into social care careers, to support them with development in CPD within their careers. And we have a whole range of efforts in terms of tackling, we have I think I described it in the chamber last week, we have a CRAG meeting weekly in which government and local systems come together to look particularly at the issues of delayed discharges and try to work out how to tackle both delayed discharges and unmet need, and what can be done to improve efficiency within the system, to try to pick up on the areas where there is best practice occurring. This is one of the things that's really difficult for local systems, is to pick up on best practice in other parts of the country and to translate it into their local system. There is no one size fits all. They have to adapt and use apply the methodology that's been used in parts of the country where it's working well to their area of the country. I've said this before to this committee, I live in the rural West Highlands. It's very clear to me there's no one size fits all, but certainly a national care service would enable us to better pick up best practice and share it around the country and ensure that our entire system was working as well as it possibly can, despite the strains.
You highlight that financial resourcing alone isn't the solution, and that the other metrics have to be considered. You've outlined some examples. To what extent are you considering legislative amendments? So, for example, the Public Bodies Act of 2014, the Social Care Self-Directed Support Act of 2013, and the Carers Act of 2016. Are these mechanisms that you could look to amend to give effect to some of the goals that have been highlighted by stakeholders in terms of addressing problems in the system?
So I'll perhaps ask my officials to chip in, but that is fundamentally what some of the National Care Service Bill is doing. It is amending those pieces of legislation to deliver the changes that people have told us through the Fleming review that they want to see.
I suppose what I'm asking is, are you trying to do this discreetly rather than as a single move? Clearly that's not carried support with key stakeholders, but could you consider taking forward certain actions through amendment of existing legislation?
So that does look like an attractive option. I can understand that you're pursuing that. The reason that we pursued the National Care Service Bill is because we feel there requires wholesale, structural, fundamental reform. And we think it is wise to bring all these things together into one piece of legislation that this Parliament scrutinises in one go. There are some things that we can only do with primary legislation. So, for example, a very crucial part of the National Care Service as proposed, and one that everybody supports, is the information sharing. That requires primary legislation. So you could perhaps pursue each of the goals of the Feely review on an individual basis, and you could probably, by regulation, achieve some of them, but there are some things you just can't do that require primary legislation.
If it's, I don't know if any of your colleagues wanted to come in on that.
No, I think you've answered
Fair
all
enough.
of that. Thank you.
Clearly, there's a problem with garnering support with trade unions, with local authorities, and indeed in Parliament itself. Is this a possible way to break through that impasse by actually highlighting where there are opportunities to implement reforms incrementally using existing legislation, and then highlighting where there are clear needs for a discrete piece of overarching legislation that could come in later? Clearly, trade unions expressed a view that action is needed in the social care sector now, and perhaps their support would be more likely if there were actions taken more immediately in certain respects.
So I work very closely with the trade unions. Many of the comments they have made don't actually relate to this legislation. They're comments on social care in general, and their view is absolutely valid. They're raising concerns about the social care system, but not raising concerns about the legislation, if I could be clear about that. I think it's really important that I listen to all of the parliamentary parties in this Parliament and work out what there is support for. What I am hearing at the moment is that there is strong support for a number of aspects of this bill. And in fact, I'm not even hearing much concern being raised about amendments. So the areas where there is very clear consensus would be things like complex care commissioning, Anne's Law, information sharing, support for unpaid carers. There's strong support for that. The issues that the trade unions are asking for, which are outside legislation, so they're not part of the NCS bill, things like the collective bargaining, sectoral bargaining, we're making real progress on that. We're very close to the point of that being a reality. In fact, the legislation that Stephen Kinnock has introduced in the UK government, in the UK Parliament, is probably more relevant for that, and I'm in negotiation at the moment with the UK government about how we can consider that legislation applying in some way to Scotland, particularly given the work that we have already done. We're well ahead of the UK government in terms of the work we've done to put fair work principles into social care in Scotland. So I'm keen to collaborate with the UK government on that piece of work, but that would be a separate piece of legislation from the NCS.
Donna Bell, Director of Social Care and National Care Service Development. John Paul Liddle, Deputy Director for National Care Service